Hello, hello, everyone. Good evening. Happy Tuesday. I see some people coming in. Everyone comes in at once. Okay. I see some familiar faces here. Some of my salmon beers. Thank you guys for joining. Okay. All right, so I think we have a couple of people already. All right. So by the way, you guys, the chat is open. This is going to be recorded. So if anyone misses anything, any part of it, you will get an email with this recording. So you can rewatch it if you want to, but definitely I'll have my messages open so that I can see any messages or comments you guys send my way. And let's get started. So welcome. We're going to speak about when grief becomes complicated. As you guys know, I tend to do one of these free webinars a month, and I always invite someone in the community that, that is really well-versed at the topic to come and help me with this. And we are Crystal Minds New Beginning. If you guys don't know us, we provide in-home, in-school, in-centers, ABA services and psychological services. And we're coming in just providing these trainings to just, provide some support for other people out there and just to kind of get like a closer together feeling with our community. So let me introduce Dr. Yesenia Rivera, who is one of my colleagues. She's also one of the psychologists that works with us at Crystal Mind Psychological Services. And I've known Yesenia for years and years and years. So Yesy, do you want to tell us a little bit about yourself and how you know grief so much?
Well, it's very nice meeting everyone. Welcome. So I went to Carlos Albizu with Dr. Gilbert, so we know each other.
Sorry, I think you got muted.
How about now? Can you guys hear me?
Good to go, yes.
So I don't know if you guys were able to hear anything that I said before. So I've been working with grief for about 5 years now. I also do a lot of trauma work, and I specialize also in geriatrics. And I think it comes with the work that I do. I work with a lot of end of life issues, and it's something that I'm passionate about. So hopefully you guys can learn a little bit with me.
Thank you, Dr. Rivera. I am Dr. Monica Gilbert, and I'm a board certified behavior analyst. I specialize more in anxiety and ADHD and autism. And I have the private practice Crystal Minds New Beginning. Of course, I specialize in ABA therapy, which is really what I love. And thank you so much. It's so weird calling you Dr. Rivera. I was going to say,
call me Yesy.
Okay. It's so, thank you so much for coming, Yesy, because, you're like, for me, you're like the guru of grief. I know you don't see yourself as that, but whenever I have a question, because I have a client, right? Because grief is everywhere. We see loss all over the place. Even though I don't see grief clients myself, I refer them to her. I still have questions because things happen, right? While you're working with clients, even with ABA clients, right? With kiddos, when they lose a pet or when they lose a loved one, how do you explain it to them? So we do see it everywhere. So I always go to Yesy and I'm like there, voice messaging her so she could help. So thank you so much for finally doing this with me. And we'll open up to questions. And I also got some of the questions on social media that some parents have. So maybe we can go through that first, and then we can go over the presentation. And if you guys have questions about grief, about loss, please put it here on the chat. I'll be looking at it. So please just put it here, or you can also unmute yourselves. So let's go to the first question. The first question is, should I speak with my child about their pet dying or make a distraction? So this was a parent that sent me this. So what do you think? Because I know this happens a lot, and what should you do if you have like a child and his pet dies? I know when my hamster died, and I learned this maybe 5 years ago, my mom actually told me, yeah, I remember that hamster that I said ran away. And I was like, yeah. And she was like, no, he got eaten by the dog. And I'm like, what? You lied to me? you know? So what should a parent do, you know, when a pet dies?
So I think it's really important to be honest with the child when a pet or when a loved one dies. I think it's really important to be transparent and explain it as clearly as possible, very straightforward. So children tend to be extremely observant. I always say that they're observant of life as well as they're observant and curious about the death. So they're gonna notice a difference. They're gonna notice that there's a loss, that there's the animal is no longer there, the pet is gone, and they're gonna start wondering what's happening. So I feel like if we're honest, if we really explain what's the reason why the pet has passed, the child is gonna understand a lot better, and they're also gonna be able to cope with the loss a lot better. So always honesty.
Yeah, and I also think that if we normalize it in some way, it helps, because imagine the child finds out, okay, my pet, whatever, you know, lizard died, and my mom didn't tell me, right? Is that because death is something bad? Is death something that we don't talk about here, right? So when you do those things, and then, you know, children are capable of listening to things and they find things out, when they see that you may be sending them the wrong information about death.
Exactly. And I always say that you see, like, as far it's also connected to your culture, to your religion, but if you can normalize it in a ways in terms that are very common to the child that he has heard before or she has heard before, like saying, oh, the pet now it's in pet heaven, or the pet it's no longer with us, but it will still be connected to you. I always like to use the invisible string where you can still feel their love and they can still feel your love. And that's a great way to kind of create that transition for the child to start to grieve.
Oh, I like that. So an invisible string where you can always kind of keep in touch with them. That's so nice. That's so nice. Yeah. We had a pet. It was like a little lobster, and he died. And my son was in here, and we found him. And my husband's like, "Oh, let's just flush him down the toilet," you know, like what you do with fishes. And I was like, you know what? No, let's leave it here. And I want my son to see it. And we're gonna do like a whole burial thing. And we went to the backyard, and it was like this whole thing. Like we did the whole thing. But he was like super cool about it.
And that's the best way to do it, because you normalized it for him. He didn't feel abandoned by the pet lobster. Like he was able to see it, see that he was like no longer there present, but you guys were gonna be able to say goodbye to him in a way that was positive. And that's important. Create a closure.
Okay, good. Good. I'm glad I did it right then. Someone else asked, I have been coping with the death of my mother, and it's been 8 months. How do I know that if this is a problem? And I know that before this, we kind of spoke about a prolonged grief disorder, and that's like a new disorder added to the DSM-TR. Just so you guys know really quickly, the DSM-TR is what we psychologists use to provide diagnosis, and they're always like kind of changing it up depending on the new research. So they just added this diagnosis in the DSM.
So I feel like for that question, it's really important to keep in mind that a loss, having grief is normal, right? We can have normal grief, but after a certain period of time, it can become, as we know it, complicated, or now prolonged grief disorder, meaning that it has been going on for too long and you haven't been able to cope with it. What we usually see as normal grief lasts for about 3 months, 4 months, even 6 months. Sometimes a little bit more after that 6 month, 7 month period, we start seeing much more of a complicated response, because that means that the person has become fixated on the grief and they're not able to move forward or adapt it to their life. I will talk about this a little bit more in the presentation, but I think it's important to know the time, because then once it reaches the year, then that's what becomes a prolonged grief disorder.
Okay.
And at that point, the person does have to reach therapy and be able to engage in I feel like treatment is really important at that point.
Right.
And finding children, it would be 6 months.
I was going to say that with children, it's a little less, just like other disorders. And also, if you guys are looking for a psychologist to work on this, go to a psychologist that specializes in grief, because if you don't, that psychologist may actually make things worse, right? Like, I don't touch trauma, I don't touch grief. Again, I refer it, right? Because I don't want to do harm when it's really not my specialty. So go to a therapist that specializes in that. And I think there's like a certification you were saying, Yessie, that therapists can get.
Yeah, so I'm getting right now my specialty in grief counseling, which is a style from our Psy.D. It's just to get more specialized in the area. And it's a lot of knowledge that we really don't learn in school.
Right. Okay. Yeah. I see that you want to stay in school. You want to continue. I'm more like, okay, I'm done after all these years. But anyways, good for you. Good for you. Okay. So let's talk a little bit about the definition of grief, and you can tell us a little bit about this.
So some of these definitions I think are really important because you guys are gonna be always hearing about them interchangeably. People use them at different times, but they don't mean the same thing. They have different definitions and they're important in the topic of death in general, not just for grief. So the first one that I wanted to mention is loss. I think loss is really important because it's just the fact or the process of losing someone or something. And you will hear that all the time. And now the important thing about loss is that I don't want you just to think about the loss of a loved one, right? When we talk about loss in grief, we're thinking also of a lot of those symbiotic losses that I know Dr. Gilbert was talking about this in the other day on social media. She was mentioning how we can also lose a job. We can go through the loss of a limb. We can go through the loss of if we have a new medical condition. So it's kind of like the loss of the health status. So it's a lot of different losses, even the loss of a relationship that can also fall on this definition of loss, and it's part of grief. It's a process that we have to grieve.
Right. And even like you were saying, like sometimes I speak with parents that have, just got a diagnosis of their son or their daughter, and they're actually going through grief, right? They're going through grief because they're grieving a loss of the child that they thought they were going to have. And now having to, okay, it's not what I think it was. Now I have to completely change it. And this is, what I have to work with right now. Right. And that can even feel like that loss, right? And you could be going through those steps of grief as well.
Exactly. You go, and then we'll talk a little bit more about stages, but you kind of go through stages as well of grieving that loss. But yes, I know you're joking, a little bit of full over disclosure before the presentation that I recently got my appendix removed, and we're talking about the loss of my appendix. So it's kind of like all those
Right.
things coming together.
Yeah. I mean, I shouldn't have made that bad joke, but it was just like coming there. No, but it is something that I think we have to talk about. We have to normalize, this a little bit. We have a question. I think this is a really good question. And I think you could kind of help with some of your expertise. And by the way, guys, like I always say, I didn't say it now, but everything that goes on here is for educational purposes only. We're not here to diagnose. We're not here to provide suggestions, recommendations. That would make us really crappy therapists if we did that. So that's something that we cannot do ethically. But we're just here to kind of, help out in the best way that we can. So here's a question. I lost my wife 3 years ago, and that was my son's mother, and my daughter's mother died 8 months later. We're still going through it pretty hard. I'm functional, but my daughter is struggling. I feel I need help navigating the water that she's in. So I'm guessing that, like knowing how to speak with her about the death is that what it is that you're struggling with? Okay. So yes, I know we kind of spoke about, some of the questions that you had, which I think fall in great place with this. So what would you say to this person?
So he lost his spouse, and now he wants to communicate it he wants to continue to provide support to his children, right?
I think it says that he lost his 3 years ago. He lost his son's mother, and my daughter's mother died 8 months later. So there were 2 losses.
There's definitely multiple losses. Okay.
Multiple losses, yeah.
So, and it happened a while back. So
yeah, just 3 years and then 8 months.
Are the children experiencing any difficulties aside from just being able to get the information? So it becomes very specific to the case, right? Because we have to see how the child is coping in order to provide that information. I would always normalize it. So I think that's the most important part. Be able to share his experience, be able to normalize the sadness, the longing of the situation, because it's multiple losses. And when there's multiple losses, that's always going to be a significant impairment in your ability to cope. It's an adjustment period. Mm-hmm. I also think that it's important that the person is very honest with his children. So explain, as I mentioned, there's a normalization that the person is no longer there, but that the person is now in a different place based on their culture, on how they express it. I think it has to be consistent with your religion to be able to express it a little bit more, so it creates consistency. And then kind of provide support. If he sees that the child is not being able to cope well, then at that point I would recommend taking it to see someone that is specialized in the area.
Right. And when you say, Yessi, when you say, just to kind of explain it a little bit more, right? When you say normalize it and when you say share what you're going through, right? So I think as parents, sometimes, you know, you have a fear of like re-traumatizing your child, right? Like you don't want them to become your therapist. Like you don't want to put it on them. So sometimes we try to not cry. We try to just, you know, be tough and strong for them. So you're saying that we should express it. We should just show them how we feel.
Thank you for clarifying that, Monica. Exactly.
Yeah.
The most important part is if you're crying, being able to talk to your child and maybe give them a hug and explain them, I'm sad. I'm sad because I miss the person that is no longer here. And it's okay if you ever feel like crying. I'm missing them because it's okay. We're both missing them together. So that's what I mean by that normalizing, being able to share and say like, this is what I'm experiencing and you can experience it as well.
Right. Because if the child thinks that you're, you know, obviously the child knows that it hurts you, right? But if the child sees that you're all, you know, composed and you're not expressing the way you feel, then they feel like they have to do the same thing, right? They don't feel like it's okay to cry. They don't feel like it's okay, you know, to do that.
I think some behaviors that we also have to really look in, especially with children, if we're seeing more problems in school, if we're seeing that the child is becoming more isolated, more introverted, it's really important at that point to notice that there's issues that need to be addressed and providing maybe more support, because those are behaviors that we see in children that they may not be expressing. Hey, I miss my last one. I miss my mom. I miss your spouse. Like these things that need to be communicated. These behaviors, they need help. That's also kind of like what we call a cry for help in that sense, because they're saying with behaviors where they're not able to communicate with words.
Right.
And they sometimes become extremely angry too, more fights. So some of those things do happen.
Right. And you send me this questionnaire, which would be good if we can kind of share it after. But the questionnaire is basically like if you're a parent that is experiencing difficulty speaking with your child about the loss, right? It's important to reflect on as to why. You know, think about how you grew up. How did your parents speak with you about the loss, right? Like, you know, what was their demeanor? You know, did they say just, you know, get over it, or you know, do they kind of dismiss it, or were they open about it? Did they share their own feelings? So I think we carry a lot of that over with us. And you spoke a little bit about, or you were telling me off camera about that intragenerational kind of stuff, right? Can you tell us a little bit more about that?
I think so. So it's really important for us as parents to be able to communicate with children and let them know how we see that, right? Because what often happens with parents is that they're afraid to talk about that or to accept that because they were not taught to actually process that. They were left with all these questions, with all this misunderstanding of what happened, kind of like all this curiosity that they never got an answer for. So if you're able to really look into yourself and see, so how did I actually process my first death? Where was I? What did they tell me? Those are questions that you can answer and then be able to answer to your children, rather than just avoid it and not be able to communicate. If we really look into ourselves, how did I process the loss of my first pet? What did my parents tell me? What did I ask? All those questions are important because that's how we can really answer the questions to our children when they bring it up.
Right. And Yessi, thank you so much. That's so much valuable info, and I'm learning so much here. But also, you know, I mean, this PowerPoint is called when grief becomes complicated, right? So if the child isn't able to express themselves, isn't able to really process that loss, that's when it becomes complicated.
Exactly. So that's actually a really valid point. So remember that grief, something that I really want to pinpoint is that grief is permanent. By permanent, I mean, and I was going to talk a little bit more about that later, it's that it's always going to stay with you. Grief is not going to go away. We're just going to go through different stages where we're processing the grief differently. That's why we have the normal grief, and then we have more complicated grief and prolonged grief. But at the end of the day, grief is always going to stay with us. It becomes complicated when we're not really able to integrate it into our life, to adapt to the loss and continue moving forward.
when it gets in the way of our life, right? Like when it gets in the way of like
You feel
us
like all that you
experiencing
have
joy.
is that loss, that you feel that you're no longer socializing with others. You feel that you have like this need to, yes. I mean, at some points in acute grief, we have a lot of benign hallucinations too. We hear the person's voice, we constantly see them, and those are normal. That's the other, they're benign for a reason. We want to normalize them, but when we start seeing them and we have this presence for about a year, then at that point it's really complicated.
Gotcha. Okay. I actually had, and I wanted to talk about this, right? Because this happens a lot, and sometimes the media doesn't help because it shows us like all these things that maybe we shouldn't do, right? When someone passes away, that make it kind of more complicated. But I heard of someone, right? Not a client of mine, but I heard of someone that would keep his parent passed away about, I want to say like maybe, I don't know, like 7 months ago. And then they would keep something with them, like, like a little piece of something, of their clothing or something. And they always would take it wherever they would go. So what do you think about that?
And it had been 7 months, you said?
Yeah. Mm-hmm.
Do you feel like did they ever mention if it was impacting other areas by bringing this piece of clothing with them?
So they would just speak to it. They would just like, oh, this is how my day went, and this is what I'm going through, and whatever. So they would, I guess, kind of that was like a symbol of that person still being there with them, which could have also been like that imaginary string. So I don't know if it was like maladaptive or not.
So, it's interesting. I feel like acute grief, which it's kind of like the first stage that we go when we have a loss, it's very acute and very significant. By significant, I mean there's a lot of behaviors that are very strong. All you think about is death. All you want to put in your mind, like all you want to talk about is the death of the loved one. You imagine them, you envision them. There's this longing that you cannot disconnect from. But once you're able to incorporate that longing into more kind of like adapting it to your life, and you know that you miss that person, but you're able to continue moving forward, you're able to just change a lot of your goals and see a future without this person, even though you know that you miss them, even though you still envision the longing, that's already an adaptation. So I could see that piece of clothing, if they were still pretty functional, could be part of the adaptation. So that's why I asked, what are the other behaviors that are coming in with that integration to the loss? Because in 7 months, you should already have a pretty kind of compound integration. You should be moving forward with your life, even though there can be moments during anniversaries that you're crying for them, during birthdays, and that's completely normal. That's not complicated grief. So I feel like that's also a very important point, because at times we think, no, complicated grief is already like if you're still talking about it 6 months in, and no, you want the person to continue talking about it. As I said, grief is permanent. It's never really going away.
Okay.
It's definitely continue functioning.
And for parents that have a child that's going through a grief episode, right? Who just experienced a loss or has been experiencing that loss. If they want to talk about it over and over, right? So from an ABA perspective, right, if we reinforce it, it continues, but then we also have to think about the emotional blueprint that's underlining there, right? So when they're speaking about it over and over, what should a parent do? How should a parent respond to that?
So I feel like, so that's an interesting point, because you don't want the child to become fixated and that's the only thing they do.
Yeah.
So, well, utilizing other strategies, maybe at that point you can connect the expression of emotions through drawings, through an ability to keep mementos that make them feel more comfortable. So starting creating transitions that can help the person cope a little bit better with that loss, rather than just talking about it, expressing it in other ways, the emotion. So it doesn't become just the communication of it and they don't change into other behaviors.
Right.
I don't know if it makes enough sense with that, but being able to incorporate, even kind of, I always encourage different activities where they're utilizing the memory of the last one, of the one that they love that is no longer there.
Right.
Activities, I mean, like writing letters, maybe doing a little ceremony, as you mentioned, with the pet, doing different things that are utilizing the emotion rather than just fixating on one thing.
Right, exactly. Okay, so that's great. Yeah, and because also like speaking about it constantly can become an issue for the person, right? So you're saying like kind of redirecting that to perhaps doing other things. Okay.
I feel
And
like something that's,
yeah.
sorry, I feel like something that's really important, that is what we really want to avoid before making grief become complicated, is a traumatic response. Because at the end of the day, that's what happens with prolonged grief disorder. There's a component of trauma to it. It has stayed for so long that they're no longer being to adjust to it as we should with a normal grief response.
Right. Okay. Okay. I have another question here. What is the best approach to the person who is going through the grief experience and started being isolated becomes a problem? So I guess them being isolated becomes a problem and refuses to receive any help. So what do you do if you have a family member, child that is going through this grief experience and just wants to isolate, doesn't want to speak, doesn't want to talk? So we have the opposite of what we just spoke about.
So when someone is becoming isolated, which is actually, it's a very common response. Many people tend to isolate when they're grieving. So reconnect them with social support. Even though they're try to engage them, what we would call as clinicians, a lot of behavioral activation, engage them in an activity. There's a lot of really good grief support groups out there where they can talk to other people that are also experiencing grief, and that helps people get out of that place. Because there's a component of socialization to it, and there's also a component of processing that is important during that grief process.
Do you know any support groups? Because this was another question I received, like any classes, any support groups or things like that can be given to people that are interested?
I don't have, but I know there's a lot of them out there, but I don't have any specifically to provide.
But I think that if you Google like grief support groups,
there's a lot in the community. Most of them are actually completely free. Like a lot of them, you don't even have to pay. A lot of churches. So through the church, there's a lot of them that you can just participate, even if you don't belong to the church. So it just depends what kind of like goes back to your traditions and religion, because I feel like that's how you better connect with those support groups.
Right. Right. And if not, seeking a therapist, seeking a therapist that can help through this.
But something else that I wanted to add, I know with a lot of people that I work with, especially with children, if the parents at times feels like they're not being able to normalize or to really communicate with the child about the grief process and process the loss, taking them to a psychologist early on helps the child tremendously. Like this, I've seen cases where children are able to process really well, really quickly, because they were exposed to the explanation immediately. So that's something else to keep in mind. If you feel like you're really struggling as a parent, then just seek help. There's many professionals out there that are able to help you, and you don't have to feel like you're going through it alone.
Right. Yeah. And I think sometimes as parents, we automatically think, oh my gosh, they're going to be traumatized, right? They experience this loss, forget it, they're going to be traumatized. And, trauma is really very independent. It is, it's different from people to people. What you may see as traumatizing may not be as traumatizing for someone else. And sometimes kids are more resilient than what we think, and they can even process it sometimes even quicker than us adults.
Exactly. Sometimes they have a lot more coping skills than we do.
Yeah, definitely. So here you spoke about the factors influencing grief process. Can you talk to us a little bit about this?
All right, so these factors are really important because they can either make the process much better or much worse. So when I'm referring to concurrent stressful life events, let's say that you experience grief, but there's a lot of other things happening in your life, a lot of other negative things. So that can make the grieving process a lot more difficult. The bereavement at that point would be tremendously difficult because you're not only dealing with the grief, you're also putting a lot of your energy into other things. In the other way, like opposite to that, if you have a life that is very calm, if you have people that are helping you through the process, then you're going to be able to grieve a lot better. A history of mental health. So if you have a previous diagnosis of depression, anxiety, any other severe mental illness, what that creates is that you have less coping skills. You're going to experience more difficulties going into processing grief. So that's something else to keep in mind. However, that can also be turned around, because if you have already developed coping skills going to treatment, you may be able to grieve a lot better too. And that relates to psychological resources, having more coping skills. People that are very connected to seeking purpose, seeking meaning in life, they tend to do a lot better when they're grieving. Having a strong social support, just like having a limited social support can be impactful. self-efficacy, core beliefs. A lot of people are afraid already of death. So having to grieve when you have death anxiety can be extremely detrimental. So it's important to normalize that. We're all gonna die at some point. I know it's a difficult topic and we feel that we're not gonna be able to cope with it. But yes, if we normalize living, we have to normalize dying. Spirituality and also family dynamics. Because sometimes when there's a death in the family, it brings the family apart and it also brings the family together. So I feel like all those factors can work either way.
Okay, great. Thank you so much. We have another question. How can you help someone that just experienced a loss in a relationship when they continue to reach out to that person which doesn't help them move on?
Okay, so that's actually a great question. I feel like with the loss of a relationship, you have to think of I don't know if you can move Monica to the different stages for Kubler-Ross. Okay, maybe we'll go back to that one.
This one? Yeah,
that one. So I think it's important that we see those stages because what that's telling us. So when we have a loss of a relationship, just like a loss of a loved one, we see we go through different stages of grieving, right? So using the model of Kubler-Ross, if we think about denial, if we think about anger, I don't know if everybody's familiar with this model, but it's talking about denial, anger, bargaining. You also have depression and acceptance. When we go through those stages and we kind of tap into them, we grieve going through different ones. Doesn't always happen in order, so that's something to keep in mind. But if we find ourselves in a specific stage, in that stage, we can have a better idea of how we're gonna react to the loss. So in the loss of a relationship, if the person is still trying to reach out, that's someone that is kind of like in a bargaining stage. They're still trying to get the person back. So they're in denial. There's a component of denial to it, but they're trying to get the person back and trying to say, like, I haven't really lost them. So if we look at it from that stage standpoint, it's kind of really processing that there is a loss, but you're not ready to fully let go of it.
Mm-hmm.
So it's just like a loss of a loved one. It's just the fact that you have to continue working on your resources. So you will have to go to your social support. You will have to reach your spirituality. You have to really connect with what helps you and your coping skills rather than fixate on a relationship that is no longer there.
Right. Yeah. And sometimes it can be a little detrimental, like even when someone is in this like kind of disbelief or denial stage, right? To kind of, I know that some people are kind of like, pushing like, you lost this relationship. Like, when are you going to realize it? Right. Or you lost this person, trying to like, force them to see the light. What do you think about that? Is that something that is okay to do? Or is that something that's very, like I said, detrimental at times?
Well, I always say that in grief, stages are just stages. They're very fluid. So it's not always going to be concrete to the point that you have to go to all of them or they're all going to happen. I think that if you have friends or if you want to go through that stage of kind of giving yourself what we call more like shock of the loss, it just depends of how you're going to be able to take it. It goes back to your coping skills and your ability to say that's going to be more harmful than helpful.
Right.
So it's very individualized. I wouldn't recommend just to everybody to, based on what they're able to do. Some people are not capable of being able to process by saying like, just accept that this person is no longer there.
So we receive a follow-up question to that one, the relationship one. It says, how about when they start drinking daily to cope? When is enough enough?
That's actually a very good question. My follow-up question to that would be, how long have they been drinking? I mean, and it goes back to the stages in grief that they're at, right? Because if they're having acute grief and it's about 3 months, we know it's already a negative coping mechanism. We know that from a coping skills standpoint, they're not being able to deal with the grief properly in a way that is helpful. But if they've been drinking for years, then we already know that it's a prolonged grief disorder. So at that point, they definitely need to seek treatment, not only for the alcohol use, but also for the grieving. Okay. If it's something that is more brief, then I would say we have to be mindful of maybe at that point, utilizing other, like if they have a lot of family support, being able to bring in the family, maybe have a family intervention, maybe use other resources that the person may have.
Okay. Yeah, I think they said here 3 weeks.
3 weeks. So in that case, it's actually very recent.
So you would say it's not really like a problem behavior per se. It's just them.
I mean, it's not a positive coping skill, but we know that the person may lack other coping skills. So maybe having more support to help her find something else to diversify their toolbox in that sense.
Right, because that just because it's been 3 weeks, it doesn't mean that in the future
That it's not going to become
right, like a very.
We never want to normalize an unhealthy coping skill because it can definitely become more harmful.
Exactly. Yeah. You don't want to say something like, oh, you're drinking, don't worry. You're like in the first stages of grief,
No, we don't want to normalize it because it can become more complicated.
Right. Okay. So any questions you guys have, please put in the chat box. We'll just go, through our next slides, but definitely any questions you guys have, please take advantage that Yesie's here, just giving us all this great information. Did you want to go over the stages of death in children?
I think that's actually a good one for children and especially for parents to talk about. So when it comes to the stages of death and the comprehension of how the child views death, this is really important because it gives us an idea. So for parents to really know what to expect of the child and what they're kind of envisioning at that stage. So the first stage, it covers ages 3 to 5. And the child at this point is going to be seeing that as separation. So kind of like my loved one is no longer here. But they just see death are also as less alive, meaning that they're not completely dead. So I think that's interesting to know that when we give them information about, okay, so going back to the pet, your pet is no longer here. They're going to say, okay, I don't see it. I don't see my pet. But in their minds, they're going to think that it's still alive. So it's also important to keep in mind that they may not be fully understanding that as something that is universal and finalized.
Okay, got it. So it's kind of like that object permanence in some way.
Exactly. That's exactly what we're talking about here.
Okay. But
they also have a lot of curiosity about that. So that's why it's important to then be able to give them a lot of information because their brains, they're just like sponges. They want to pick up on everything that you give them about that. They're just as curious about it as if the pet was still there.
Yeah. The other day I was speaking with my little one. Well, he's not that little, he's 6 years old. And he was saying something like, oh, we're talking about, like 70 years from now, he's into space. And he's like, what's going to happen with this planet? And he's like, it sucks because you guys are going to be dead. And I was like, oh my gosh, he normalized the crap out of that, right? Yeah, we're just gonna be dead. You're right. And it took me some time to process it because I was like, oh my gosh, yeah, in 70 years, I'm gonna be gone. But he just said it very like nonchalantly. And I thought that was so interesting, right?
Well, clearly he's not experiencing a fear of death. So that's good. That's definitely very positive.
Okay, and then so that's stage 1, and then stage 2.
It's ages 5 through 9. So I think it's funny how you're mentioning that, and he's 6. And from 5 to 9, you get to see a lot more of that death is final. But there's also a belief that that one might escape it, meaning that the pet or the loved one, yeah, death is final, but this person may not have it. They may be able to just keep it all together. They may not die. Or even though like my pet, you're telling me that die and I don't see it, but maybe they escape it, they just went someplace else. So those thoughts are also going through their minds.
So also like when they start thinking about, when they start talking about like heaven and this, if there's not that like hardcore spiritual, thing going on in the home, but if randomly they're like, oh, this person went to heaven. So that's sort of like this stage.
Exactly, pretty much. It's also that they start seeing that there's a lot of personification to it. So they either see it as monsters or ghosts, or there's kind of like the Grim Reaper. So based on whatever they're exposed to on TV or on books or what you tell them, they're going to start just personifying, kind of creating a person out of that. It's not going to be just that. It's going to be something that they visualize with it.
Gotcha. Okay. And then stage 3?
And that's from age 9 all the way to being an adult. And at this point, that's when you start seeing death as personal, universal, final, and irreversible. So it's inevitable. It just happens and it's not going to come back. And that's the stage that we kind of like after age 9, we just develop into.
Okay. Do you feel from your experience, right, and what you've read and what you've researched and all that, because of the way that they're interpreting death, that, ages 3 to 5, they process it with less of that kind of like an emotional investment, or less of that, kind of trauma than maybe adults.
Completely, you just hit right on the nail, because at that point they don't see that as something that it's negative. It's more like, okay, it's no longer here. And that's why a lot of, like, with parents especially, grieving, they're really grieving the loss, they're really sad, but then sometimes they worry that the child is not processing correctly because they're not sad. And it's just that to them it doesn't have a negative connotation. Death is just death. And over here, and it's fine. Doesn't mean that the child didn't love the person that is no longer there. It's just a different processing of the emotion.
And I think this is like, so I love the stages of death, in children and all that. It helps us understand it too. And I think it's also a relief for a lot of parents, right? Because, for example, I've experienced, loss, right? And if I were to think that this pain that I'm feeling, my little one would feel, I just don't know how they would be able to cope with it, because I'm barely coping with it. So how can a little one do that, right? So for a parent, it's so hard to even think that. But when you show them this, it kind of gives you sort of like that breather, like, maybe they're not feeling it as much as I am as a parent.
Also remember that as adults, when we grieve, we're not only taking in the death and the grief and the loss on its own, we're taking in all the experiences, all the emotions, all the memories that we have with that person. So it becomes a lot more significant. That's why grieving is so difficult, because we're taking in an entire lifetime. We're not just taking in a moment or news. So that's why it's so much more complex for adults and for children.
Yes, definitely. It's so important. So questions you guys have, please put it here in the chat. Let's move on to the next slide. So I think you kind of went over this, but can you just kind of go over it?
I apologize because I've been a little disorganized. I haven't been going through it in order.
Don't worry, the webinars are usually very disorganized, but people get, the good information. So
I feel like this is one of the most important information that I'm going to share, the types of grief. And as I mentioned before, we have acute grief and integrated grief, and they're kind of like what we see as normal grief. That's what we all kind of want to go through. That's the normal grief process. When we have a loss, any sort of loss, we should be experiencing those two together. For clinicians, that's what we know in the DSM as uncomplicated bereavement. And then the complicated grief, that's kind of like when we start seeing that we become more stuck. That's after that 6-month stage, kind of like we have more issues, we develop more negative coping skills. And then after that, we hit the 1 year with the prolonged grief disorder. And I want everybody to think about prolonged grief disorder as a component of grief that has a traumatic response to it. That's why it's a lot more significant and has actually a mental health diagnosis.
Got it. Okay.
So I'm going to talk more specifically about acute grief now, because I covered it briefly. As I mentioned, it's the initial period after the loss. So it begins right after a person learns that they lost a loved one. It's like right at the moment when you get the news, that's when you start acute grief. And it's made up of 2 elements. It has the separation response and the stress response that comes with grief. And it includes a lot of strong feelings. This is where you have like really heightened emotions. You have longing, sadness, a lot of yearning for that loved one, a lot of anxiety, bitterness, anger, guilt, shame. All of these negative emotions kind of come together. A lot of the thoughts and images that the person experiences, their life is just predominated by the loss. Everything that happens is just that the person doesn't have that person in their life, or that symbiotic loss. As I mentioned before, this is where you hear voices of the loved one, you start seeing them, you see like things, you see all their belongings around, you want to kind of like keep together a lot of their stuff, but those are benign hallucinations. They're not bad, they're normal. As long as they stay with us for about 3 months, you should be fine. And it is natural to experience this in stress grief after someone very close to us dies. The next stage is what we know as integrated grief. And this is the adaptation to the loss. This is the one that we really want to be able to follow up after acute grief. This doesn't mean that grief is over or that the person have moved on. It just waxes and wanes, meaning that it comes and goes. This is the stage that we kind of follow through forever after we lose a loved one. There's a lot of thoughts, feelings, and emotions that are related to the loss, but we start integrating them into our life. And we kind of like a lot of the emotions, yes, we start honoring what the person meant to us, like their loss, the fact that they're no longer there. We start honoring them in activities that we do. So it's kind of like a commemoration of their memory in our lives. Just say like the way I like to see it is that grief just finds a place in our life for that person. Also, when the intensity diminishes, there kind of comes like a finality to it and the consequences of the loss. So we start making changes in our future without that person. So I feel like that's important to the adaptation. Once you can see yourself moving forward and not including the loss, the loved one in your plans, there's an adaptation to the loss.
Like, for example, going to, I had a, so I knew someone that was going through grief, and, they weren't able to kind of like go to a certain cruise because that cruise was always with this person. So the moment that they were able to actually do that is when they started, I guess, integrating.
Exactly. Another example that you see often, I mean, if so sometimes there's like a loss where there was an event, just like the cruise, let's say a graduation or maybe a birthday party that they were gonna be commemorating this person, and the person is not there, they may not want to go all together. So there's an avoidance. And that's a lot more of a complicated grief response than what you would see in integrated grief.
Okay, got it.
So in that case, just being able to follow through, that's the real integration, just making future plans in that sense.
Okay.
However, I want to make this is very important. The person, it's never really gonna get over it because, I mean, get over that grief response, because there's gonna be emotions that may come back. So during holidays, during a specific birthdays, during the actual anniversary of the death, they're gonna feel just like they had an acute grief episode. In a lot of the grief research, they call those moments pangs of grief, meaning that these are intense episodes that you get just really, really sad and you start experiencing all that acute grief, kind of like this. It happens like the moment that there is some sort of anniversary, that it can kick in for like 2 to 3 days, sometimes a week, but then it goes back to integrated grief. And those are like very brief episodes that come in like within the integrated grief.
Gotcha. Okay.
And then just moving forward with complicated grief, that at this point is kind of like that stage where it becomes a lot more kind of just holds like the person's mind, and they won't let go. They will move forward. They become too stuck in the grieving. It's kind of like they're having acute grief for 6, 7, 8 months. At that point, it's no longer an integrated response. They're not able to move forward and adapt.
And they feel it the same exact way than those first
in those
moments.
Yeah, it's like the same intensity. It hasn't changed. So there tends to come with a lot of maladaptive thoughts. So you tend to see a lot more difficulty regulating emotions. You tend to see more difficulty with adjustment. They're not moving forward. They don't get to see that future without the presence of the loved one.
Right.
A lot of them feel like the damage by the loss is not gonna be repaired. That it's just irreparable. They don't contemplate ever feeling better. They don't contemplate the future. They just feel like this loss of purpose, of meaning in life. They feel like their life is not moving forward without the disease. There's not just a respite inside, and the relationships become extremely impacted. So once you get to complicated grief, you feel like you don't want to make new friends. You don't want to socialize anymore. And it's as I mentioned, it's that acute grief that you can see for 6 months maybe, which is a while, but it's for a really extended period of time. It has been going already 8, 9 months, and they haven't moved forward from there.
Okay. Yes, we have a couple questions, but let me read the one that's more so integrated into this. And one thing that I wanted to point out is, just the same way that she just went over the different types of grief. Remember, you can be experiencing one type of grief, and if you have a little one that's also going through that grief, or someone else who's with you, that person can be at another stage or another type of grief, right? Which can become a little bit weird to kind of,
That's actually a great point to bring about. Yeah, because then it creates also that, maybe they don't miss them as much as I do, or they maybe I feel like I'm more like I'm making it more about me. So it becomes even more difficult for the person to grieve because they think there's something wrong with them.
Yeah, like siblings. We see this when a parent, right? When there's the loss of a parent, and you see the siblings react to it in different ways or cope with it in different ways.
And in the same household, sometimes we can see two people coping with a completely different. Even in children, you can have a child like similar ages, and one may be already in integrated grief and doing much better, and then the other one may be going into prolonged grief disorder because they just have different coping skills, different personalities. And even though they may have a parent that may be explaining it to them the same way, everybody copes differently with the loss.
Yeah. There's a question here. What is the estimated time between acute and integrated grief and so on?
So that's actually a great point. So acute grief doesn't have an exact timeline. So it can last a week, it can last 2 weeks, it can last 3 months, it can last 5 months, and it's still acute grief. Some people can go into integrated grief for a week and be fine. And they just move forward from there. And they remember that integrated grief never really finishes. It's just gonna stay with you. The loss is just gonna be integrated. But then you're gonna be able to see that change it's quick like that. It doesn't take a long time. Now I want you to think about after the 6 months, that's when the complicated grief starts happening.
Gotcha. Okay, so the time mark to kind of focus on is after 6 months.
I would say so, because that's when it becomes more of an adjustment disorder. We're thinking about it more in terms that as clinicians, that it's more diagnosable because it's impacting your day-to-day a lot more.
Right. Yeah, you've been feeling it, and it makes sense. You've been feeling it for much longer, right? So it kind of already generalized into everything that you do, and it kind of maintains. I have a question here.
Before I forget, Monica, sorry, I'm going to stop you right there because I'm going to forget about this. For complicated grief, you can actually, if you hit that 6 month mark and you feel like it's becoming more problematic, you can actually go to therapy or address it with someone, and it can get resolved. It doesn't always lead to prolonged grief disorder. So I feel like that's something important to pinpoint.
Okay, yeah, good point. Excellent point. So is it okay to take a child to a funeral, etc., or can this be traumatic for them to see people in distress?
So I'm really glad they're bringing that question up because it's highly important for us to normalize the process of grieving. And that's just what we call mourning, right? We have to normalize the funeral process, the wake, being able to take them to mass. So based on your cultural traditions or based on your religion, so important to involve the child, because the child can feel completely abandoned or isolated or misunderstanding, like he may not understand what's happening because they're not being involved. I always say that it's important to ask the child whether they want to join. Other than just, okay, we're taking you. You ask them and you try to explain why you want to take them. If the child says no, then respect that because you offer and you explain.
Exactly.
But never force the child, but offer it so they feel involved and they can have a better understanding.
Okay, good. Yeah, I love that. Another question. Hi, everyone. A year ago, we lost my son's father. He's 14 and is turning 15 and still has no motivation. Every time I take him to his dad's grave, it's worse. Should not take him. It's a difficult age. So she's saying, I think she's saying, should I not take him? And it's just, or is it a difficult age? So how do we, the first question is that, and then the second question is to like, during those adolescent years, like, how do we know if something is grief or something is just someone being an adolescent?
So that's actually a great point. I think that with an adolescent, it's important to have the communication of asking what you said about going to his father's grave that makes him upset. Mm-hmm. It's because he feels that he's not benefiting from it? Is it that he is coping with or grieving in a different way, remembering his dad in a different way? So always asking those questions, being able to communicate about the emotion behind what he really doesn't want to go. There's a clear explanation to whatever he's experiencing that he knows that he may not be able to verbalize, but he's doing it through behaviors. So he may feel uncomfortable, or he may actually be experiencing more severe grief and may need to talk to a professional because it's been a while. I think that with adolescents, it may not just be rebelliousness. We may have to address it from a different standpoint, especially because that needs to be communicated. We cannot cannot really just interpret whatever the adolescent is experiencing.
Right. And going back to the slide that Dr. Rivera went over about kind of like the different things that can make grief more complicated, right? That's I think one of the stressors or the things as well, right? When you're in adolescence, you're going through all these body changes hormonally, all of these other changes, and now you have grief as well, right? So it's kind of like an added stressor to it. So it can actually exacerbate those symptoms. Right. Okay. So we're almost at the end of our presentation, but which one do you want to go over? The risk factors. I think
I will
yeah.
go over those very quickly. So I'll go over the risk factors for prolonged grief disorder. And these ones are important because they are gonna show whether the person is gonna have more of that kind of like a higher factors of actually developing it. So if you have a history of mood disorders, that may increase your predisposition to have prolonged grief disorder. If you're using any substances, if you have a history of multiple losses, so if you have lost several loved ones, I feel like that happened a lot in the beginning of the COVID-19 pandemic, because a lot of individuals were experiencing so many losses one after the other, which really put them at that stage of moving forward with a prolonged grief disorder, because it's just really hard to cope when you have so many stressors. Also depression in early bereavement. These are people that are depressed from the moment that they start acute grief. So that makes it much harder to go through the stages. So how the relationship with the deceased. So if they had a positive relationship, usually it's not such a risk factor, but if they had issues with them, then it becomes a bigger issue. Context, meaning kind of like, was it kind of like a negative death? Consequences of the death, sometimes in violent situations, in suicide cases, it's a lot harder to be able to process the loss, and it becomes more, you're a higher risk of prolonged grief disorder. Also limited social support, conflict with friends or relatives, because that means that you're going to have a limited social support during the grief process, and financial problems. I feel like those are like the main ones that increase the risk of developing a prolonged grief disorder rather than being in acute grief or complicated grief.
Right. And this doesn't necessarily mean that you're absolutely 100% going to have a complicated, right? But the more risk factors you have, the more likely you are, right? Is what this says.
And that's a great point that you're making, Monica. Sometimes you have a lot of risk factors, but you're still able to overcome it. So that's also important. It's just for us to know kind of like how we manage those risk factors before they become more complex.
Right. And then coping with bereavement.
So this slide is mostly targeted for children. So kind of like how parents can help children cope with bereavement. We can talk a little bit more how adults can do it. But for children, so having a lot of open communication, as I mentioned before, options to attend the funeral services, as I also mentioned already, understanding of death. And by that, I mean really helping the child, like know what the child understands as the death. Not making any assumptions or thinking that they're going to be sad about it, just really understanding what they think is death. It's encourage expressing emotions, so being able to really talk about different ways to express those emotions, whether it's through art, whether it's through events. Sometimes just going to therapy can also be a good way to cope with bereavement. When it becomes a little bit harder, being able to just go to grief counseling or groups or support groups. And I think I jumped one, providing emotional stability and consistency. And by that, I mean, whenever there's a loss in the family, usually the person that is experiencing the most grief, if it's the loss of a spouse, will probably be a little bit more detached or isolated from the child. So it's really important that there is a person that comes in and really supports the child during that time. So shows that there is an emotional stability and consistency, because we don't want the child to feel abandoned during the process of grief.
Okay,
that's
great.
pretty much it. Oh, the recommendations. So I do want to recommend 2 books for parents to help their children with grief.
Hi.
When your grandparent dies and something very sad happened, or great.
Go ahead. Yeah. Yeah.
So 2 of them that I was just mentioning is where your grandparent dies and something very sad happens. And those are my last recommendations. They're great books to explain to children how to process grief. They're very entertaining, very engaging. And I used them myself in treatment, and I highly recommend them. I think they're a great guide for children.
Okay, thank you so much, Dr. Rivera. Anyone have any questions? We have maybe just a couple of minutes left. So any questions you guys have, you can unmute yourselves. Now you can unmute yourselves, or you can put your questions in the chat, whatever is easier for you all. But now is the moment to do it. So let us know before we disconnect. And Yessi, thank you so much for doing this. I mean, I learned tons, right? I don't know about you guys, but I learned tons. I think someone unmuted themselves. Marissa? Yes, no? Okay, so yeah, so thank you so much for coming here and just, you know, speaking about all this. I think it's something that we have to speak about more often. And I think every clinician should receive at least, you know, some type of grief counseling, because it doesn't matter if we work with kiddos doing ABA or whatever it is, we're always going to be, you know, we're going to experience losses. If we don't experience them themselves, we're going to see our clients experience them. And it's important for us to at least know what not to do, right? We may not know exactly what to do because it's not our specialty again, but at least we know what to stay away from and what's kind of like consider, you know, maladaptive or pathological, and what's considered something normal, right? Where we don't necessarily have to refer to a therapist.
Exactly. Well, I really appreciate doing this presentation and having this discussion with you guys. I love talking about grief, so for me, it's just a pleasure.
I noticed that this is your passion. Oh, so I have a quick question here. Books are good for children around what age?
Okay, so something very sad happened is for toddlers, and when your grandparent dies, is for older children. So you can actually use that one up to the age of adolescence. So it has like you can use it for a lot more for age groups. It's more.
Okay, cool. Yeah. All right. Well, thank you, Yessi. And thank you everyone for coming and being here. And just, you know, let me know what other topic you guys are interested in hearing about. And that's it. I hope you all have a great night.